Welcome to the first live event of 2022 for the Community Foundation's Insight Hub, an information series that offers actionable insight to inform your giving. Powered by the Community Foundation's experience, network, and informed by the lived experience of Vermonters, the Insight Hub offers webinars, live events, briefs, and peer-to-peer experiences that help philanthropists and funders understand where their giving can make a difference in Vermont. Today, we will hear from the Public Assets Institute, followed by a panel discussion with their staff and an audience Q&A. Today's panel discussion will be facilitated by the Community Foundation's own Kate McCarthy. Kate joined our community impact team in 2021 as a program officer and has rapidly become a key member of our impact team. Before I turn it over to Kate, a couple of housekeeping notes. First, note that we've turned on the transcription, so you have the ability to turn it on in the lower menu if you would like to see the transcription of the discussion. Second, there will be abundant opportunities for attendees to ask questions. We will have one 20-minute audience Q&A at the end of the session, but we encourage you to submit your questions at any point using the Q&A feature, not the chat feature that you should see at the bottom of your Zoom window. And you'll have the opportunity, if you choose, you can ask a question live. You can unmute and turn on your camera, but please still type your question into the Q&A, and then you can select ask a question live audio only or ask question live video. Our tech folks are working in the background and will then be able to give you the ability to turn on your mic or turn on your video. The chat shows and is active. So please remember that if you do engage in the chat, it is visible to all attendees unless you choose the option to only send to the hosted panelists. Additionally, if questions come up, as they likely will given the depth and breadth of the presentation we're about to see, if the questions come up after the panel concludes and the event concludes, feel free to send them to info@vermontcf.org. And of course, this is being recorded and will be posted on the Community Foundation website. So now I'm going to hand it off to Steph Yu and Julie Lowell from the Public Assets Institute. I really want to express my gratitude to their team for this insight and perspective on Vermont communities and the deep partnership between the Public Assets Institute and the Vermont Community Foundation. So thank you all for joining us, and I look forward to the presentation. Thank you.
Thanks, Dan. And thank you so much for having us today. We're really excited to be here to talk about our annual State of Working Vermont report. But we're also excited that this Insight Hub exists at all. We really appreciate the work the Vermont Community Foundation does to better understand the shape and scope of the challenges that we face as a state and to kind of figure out the best ways to plug philanthropy into those challenges to make the biggest difference. So before I turn it over to Julie to really get into the meat of the report, I want to kind of set the stage for this conversation by acknowledging a couple of things. First, the report is an effort to look at the impact of the pandemic on Vermonters today, but to state the obvious, the pandemic's not over. When it began almost 2 years ago, we, and I'm using we as the state and country there, we were treating this as the public health crisis that it is. And our main goal, our main focus was really on keeping people healthy. That meant that we were paying people to stay home. It meant that we were housing people that might otherwise be unhoused. And we were providing essential workers with PPE and eventually hazard pay. But lately, the conversation has shifted from one about a public health crisis to really focusing on the economic effects, specifically the what's being called the worker shortage and inflation. And both of those concerns, I think, are missing the fact that we're still facing this public health crisis, that the level of virus spread is such that it's causing higher levels of hospitalizations than we've ever seen. It's closing schools and childcare centers and other businesses and disrupting non-COVID healthcare. Second, while a lot of the direct government aid to individuals has run out, like stimulus payments, supplemental unemployment, and the temporary expanded child tax credit, the state still has American Rescue Plan funds to spend over the next few years. And the decisions about how to spend those funds are being made by the legislature and the governor now during this legislative session, which means that it's a critical time for input from Vermonters. So we still have time to shape the short-term response to the pandemic, as well as kind of lay the groundwork for continuing those services that are essential to Vermonters for the long term after this pandemic ends. And the third and last thing that I'll note, and which Julie will also talk more about, is that since the pandemic began, government has taken on a bigger role than it's had for decades. Just to put it in perspective, the amount of federal aid that Vermont has received over the 2 years of this pandemic is roughly 5 times what we would get in a typical year from the feds. So it's a lot of money. And there's a role for the private sector and philanthropy as well. While government can act on a much bigger scale, philanthropy has the ability to respond quickly, to develop creative initiatives and identify and fill those holes missed by the broad responses. So with that, I'll turn it over to Julie to dive into the report.
Steph, and thank you again to VCF for having us and to all of you for being here. So I'm just seeing if I can get my screen shared, but I'm going to start talking while we're working that out because the first one is just a cover slide anyway. So the State of Working Vermont report is an annual publication that looks at Vermont's economy from the perspective of everyday Vermonters. How are Vermonters faring economically? How are they meeting their daily needs? And how are resources being distributed in the state? Typically, the report, which we've been putting out now for 16 years, is presented as a chart book where folks can pull a page or two from the report to use as needed to look at and share a specific indicator. But the report also offers analysis of what these indicators mean when taken all together. Advocates and legislators use State of Working to inform policy developments and proposals, and nonprofit partners use the report to inform their program development. Each year, people know they can find a core set of indicators in State of Working, as well as additional data that sheds light on current issues and concerns in the community. But since March of 2020, much like everything else, this report has been upended. Just see if I can share my screen with you all now. Thank you. So the reason for the report getting upended is sort of twofold. First, the usual data that we look at to see how Vermonters are faring. So we usually include poverty and income by different household configurations and populations, housing affordability, health insurance coverage. This data collection was disrupted by the pandemic. 2020 survey collectors didn't go door to door. So it made the information that was typically collected either unavailable or unreliable. And second, the data that we use in State of Working Vermont usually lags by a year. So at the end of 2021, annual 2020 data is available. But the churn and uncertainty in every aspect of pandemic life made a look back at 2020 seem almost irrelevant to understanding where we are today. So for those of you who are familiar with our pre-pandemic reports, you'll find that this year's report is really different. Our 2021 report brings together COVID data, vaccination data, economic indicators, federal and state financial data, and employment data to put the last 2 years into context. So from that initial state of emergency from March to June of 2020, to the gradual reopening in July of 2020, to vaccine distribution at the start of 2021, and then finally a Delta and Omicron whiplash in the late summer and fall of 2021, the report chronologically puts all of the pieces together to tell the story of this dynamic time. Many of us experienced the pandemic in discrete moments. For me, that was when I found out that the school year would be shutting down through all of June, and I had to work full-time while trying to teach my 2 young children. And I imagine that all of you have at least one of those moments, or if not many of those sort of discrete moments of I'm in a pandemic. But what the report really does is it brings all of the pieces together, providing detail and a look from the 30,000-foot view. As you'll see from the data I share today, we still don't have all the information and some data don't tell a coherent story, but nevertheless, 3 main themes emerged from our analysis. Over the course of the pandemic, we found that when government springs into action, it can meet people's needs. We witnessed the most comprehensive, aggressive government response to a crisis since World War II, and it worked for the most part, supporting the needs of many people and businesses, enhancing public services, and softening the economic impact. We learned that people do better materially and psychologically when they have enough money, and so does the economy. Individual payments, supplementary unemployment benefits, and rent and food aid from the government all help people weather joblessness while boosting Vermont revenues. And while this seems like a no-brainer, this basic idea that people do better when they have enough money doesn't always get applied when we're making policy. And finally, we found that when crisis hits, Black, Indigenous, and people of color and women get hit the hardest, but that policy can change that. Again, it may not have been a surprise that BIPOC Vermonters and women were hit the hardest, both in terms of health effects, vaccination rates, and economics. But good data and timely data led to important policy adjustments that helped to mitigate some of the worst effects in the first 2 years of the pandemic. So some of the changes that we've seen throughout the pandemic are encouraging, and they're a reminder that in doing our best to adapt, some positive outcomes are possible in this difficult time. So I'm going to walk you through each of those points in a little bit more detail, providing context to the three findings. So in the spring of 2020, institutions quickly shut down. Businesses and schools closed, long-term care facilities stopped visitation, and nearly 80,000 Vermonters found themselves without work, and 100,000 children and families were impacted by school and childcare closures. And the government, both the state and federal, they responded with emergency guidance to protect public health and keep the crisis under control. And they also responded with emergency resources. So through 2021, this has meant nearly $11 billion of federal pandemic relief for Vermont through 3 different rounds of federal appropriations. This was massive government investment, and about a quarter of the dollars went to Vermont businesses, 42% to public services, and a third directly to individuals through expanded unemployment benefits, economic impact payments, and expanded tax credits. So the chart you're looking at on the screen here, it shows the totality of all the 3 rounds of funding. But if you're interested in looking more closely at all of the programs supported by the 3 appropriations, the report breaks this out further with a chart for each round of the funding and the programs that it supported. But overall, the biggest expenditures went to the Paycheck Protection Program, healthcare, housing, and education, economic impact payments from the IRS, and unemployment insurance. And from this spending, we did learn that people do better when they have enough money, and so does the economy. So one of the biggest supports to Vermont came through expansion to unemployment insurance benefits to support people who couldn't work because of the health crisis. So typically benefits are about 57% of a worker's weekly wage, but for the first few months of the pandemic, workers also received $600 a week in additional federal supplemental benefits. Those payments expired, but later Congress approved a $300 a week supplement from late December of 2020 through September of 21. And as you can see from the 2 charts on the screen here, people were able to replace lost wages and get closer to meeting their basic needs, whether they were a minimum wage worker or someone receiving the maximum weekly benefit with these expanded benefits. But it's also important to note that this aid ended 5 months ago, and we're still in a pandemic that's creating work disruptions, especially for those who don't have paid leave and sick time benefits, forcing people to leave work and give up their pay because of illness or to care for kids who can't attend childcare or school because of COVID. So through federal relief funds, we also know that people were able to maintain housing and get emergency shelter, and that these public dollars are still at work keeping people in emergency hotels and providing others with rent and mortgage assistance so they can continue to live in their home. Increases in the Supplemental Nutrition Assistance Program, or 3 Scores Vermont, continue to help people weather the uncertainty of how they'll put food on the table, bringing millions more into the state. And this aid was further supplemented by other new and expanded meal programs. And of course, public dollars created a robust public health response, with nearly 80% of Vermonters 5 and older at least partially vaccinated. During this time, we know that child poverty dropped when we specifically look at 2020. And part of this was due to the increased unemployment benefits. So for low-wage workers, they were able to better meet their needs with these benefits. And then we know that in 2021, additional economic impact payments and expanded child tax credits put cash directly into people's pockets, having an even greater impact. So the child tax credits were especially impactful because they provided monthly payments to families with children under 18, and they made the credit fully refundable for the first time. So for low-income families who owed taxes that were less than the credit, they still received the entire financial benefit. And it's estimated that this lifted half of the 8,000 Vermont children in poverty above the poverty line, which was especially impactful for Black families who face the highest rates of family poverty in Vermont. So while this is really exciting, what happened in 2020 and 2021, we'd hate to see this poverty reduction go backwards in 2022. But right now, the federal child tax credit expansion hasn't been forwarded to 2022. For those who were still in the workforce, wages did rise. And part of this is a result of workers being paid more, But I also want to point out that part of this effect that you're seeing on the graph here, on the chart here, is that we lost a lot of low wage workers. And so those people got left out of this calculation. And so while some of this chart captures an actual rise in wages, some of this is because there are fewer low wage workers being captured in the equation. As we worked on the report, one of the surprises was that in the midst of this crisis, state tax revenues increased over the last 2 years, thanks to the impact of public investment. With federal government support, Vermonters spent money they wouldn't have had otherwise on groceries, fuel oil, snow tires, etc. And then the employees of the grocers, fuel dealers, and tire shops spent this money. And it was transformational in people's lives. And we can see this in increased economic activity in the state's tax receipts. So this, along with increased personal income receipts, has had a positive impact on the state's revenue. The revenue forecast in July of 2021 showed a 3-year state revenue surplus that was $864 million more than pre-pandemic estimates. And the January 2022 forecast, which just came out last week, showed another $80 million from what you see on the screen. To put this in even greater perspective, at the beginning of the pandemic, before we knew the extent of federal aid, the revenue projection showed Vermont revenues dipping by $620 million. So while these data points speak to people doing better materially, we also conducted interviews with Vermonters impacted by the pandemic, and we found that people used government transfers to help stabilize their finances, such as paying off student loan debt, and to invest in personal needs to set them up for the future. So that may have looked like a long overdue car repair so that people could continue to get to work or to the doctor, or a phone so employers could reach them about a job or people could be in touch with service providers. We saw evidence where this money gave people the ability to make targeted decisions to improve their financial situations, but also gave them financial or psychological relief as these stresses were lifted. So despite these positive signs, the news obviously has not all been good, and some Vermonters were impacted more severely than others. We know at the end of 2020, Vermont median income actually fell, leaving households with less to live on. This is likely because at that point, 25,000 Vermonters remained out of work, with unemployment insurance not replacing all of the lost wages of many workers. And some of the loss in household income is driven by households who had multiple earners, and maybe one earner stepped out of the workforce as people turned from paid employment to child or elder care. The labor force continues to be down 25,000 people compared to pre-pandemic, and it's not clear what folks are doing for income now that expanded unemployment eligibility has ended. Some people may have retired and left the workforce permanently, while others might be waiting for public health conditions to improve or for fewer school disruptions before they go back to work. With fewer people working, there have been a record high number of job openings in the state. So in just this most recent report in November, 23,000 job openings existed in Vermont, with a little over 8,000 people looking for jobs, with openings outstripping available workers 3-to-1. And wages continue to have a role to play in the calculus of how much or whether people will go to work. We know that Vermont's wages in 2020 were low compared to other states and the US average. And while we saw some real wage growth during this time, where we believe some people were trading up for better wages in response to the rise in job openings, we know that Vermont's wages overall still need to increase. And when we break all of these data down further, we're reminded when crisis hits, Black, Indigenous, and people of color, or BIPOC, and women get hit the hardest. But we also saw that policy can change that. We know that BIPOC Vermonters and women are disproportionately represented in low-wage jobs, and we know that they're most likely to get left behind in an economic downturn. BIPOC Vermonters were hit disproportionately by COVID. The chart here shows, if you look at these, the tall bars, show that from March 2020 to October of 2020, Black Vermonters, Asian Vermonters, and other Vermonters of color had much higher shares of the total COVID cases compared to their representation in the population, the bar that's in the front. But by October of 2021, their share of cases had fallen dramatically. And while vaccination rates initially showed much shallower growth for Vermonters of color, we saw that there began to be an uptick, and that in response to data collection that broke data down by race, through the Vermont Department of Health, the state adjusted its vaccine distribution plan in April of 2021, opening up vaccines to all Vermonters of color. The Vermont Department of Health, in order to do this, partnered more closely with new partners who were in trusted communities of color already to connect people to vaccines. This strong partnering remains an ongoing need so that we can overcome language and transportation barriers to get public health, education, and basic needs resources to all communities. And there's an ongoing need for the government to overcome years of distrust from BIPOC communities. So partnering with these community groups already working in communities of color is really important. Women also experienced the pandemic differently. We know that women have borne most of the burden of caregiving during the pandemic, and support for their children would help ease that burden. At the beginning of the pandemic, women made up 2/3 of those working from home, and they made up the majority of unemployment insurance recipients. This likely had to do with women taking on a disproportionate share of childcare responsibilities with school and daycare closures. And the result is that through the second quarter of 2022, women held 22,000 fewer jobs, while men held 18,000 fewer jobs compared to the same quarter of 2019. Family-friendly policies like affordable childcare and family and medical leave would improve life for all workers and their families. We also know that BIPOC Vermonters tend to be unemployed longer than white Vermonters and are likely to lose more ground in economic downturns. So we need to be focused on making sure everyone's able to recover economically and not just be looking at numbers in aggregate as we work on policy responses to the pandemic. So the report has left us hopeful and at the same time recognize that more work needs to be done. We have seen the good that government can do to ensure people can meet their basic needs, but we're still in a public health crisis and much of the relief has ended. And we know many Vermonters were living in crisis before the pandemic, unable to meet their basic needs. So there's a real opportunity now for Vermont to harness the lessons that we learned from the pandemic and use state resources to ensure that all Vermonters can meet their needs to the benefit of those individuals and the state as a whole. So as much as this can feel like a daunting time, the reality is that as a whole, the state has the resources it needs, and there are many who have interest to make some impactful changes. So just to give you a few examples, there's a bill in the legislature right now to enact a state child tax credit, which would make up for some of what will be lost if the expanded federal credit for 2021 isn't carried into 2022. There's movement to begin increasing unemployment benefits, initially by an additional $25 a week and possibly more going forward. And there's a push to increase Reach Up, the state support program for low-income families with children, providing benefits that would ensure people can meet their basic needs. And of course, public investments in childcare, paid family medical leave, and expanded sick days would all help workers. And there are certainly pockets in it throughout Vermont interested in expanding these programs. And these would ultimately make work accessible to many more people who currently are not in the workforce. So with that, I'll turn it back to Steph.
Thanks, Julie. Just to kind of wrap this piece up, I just want to say that Julie and Jack Hoffman, who's our senior policy analyst, they do a really great job kind of filtering through a whole lot of data to put together a report that we hope is coherent and helpful. And as Julie said in the beginning, I think we're really striving to use this report to communicate about how Vermonters are doing, who's struggling and why that is. But I also want to acknowledge the limitations of what this report can tell us. You know, at Public Assets, we talk a lot about a state that works for everyone, no one excluded. So when we say no one excluded, that means that we want to take every Vermonter's story seriously. And that's kind of a harder task, to make policy that allows for all individual needs to be met. We do need to focus on race and gender disparities and other inequities that point out systemic challenges that we need to address. And we also need to listen to Vermonters with unique needs. And we're at a moment where anything is possible. All this federal money presents a once-in-a-generation opportunity to make transformational change in Vermont. So in the short term, we need to ensure that the federal money is spent wisely over the next 3 to 5 years. And during this time, we need to adopt fiscal policies that allow us to sustain the newly transformed Vermont. There are specific projects that philanthropy can undertake during this period that we can talk about in more detail. But more importantly, I think Vermont's philanthropists can champion the idea of making a sustainable transformation. It's an opportunity to actually fix some of the problems that philanthropy tackles year in and year out. And so to put your weight behind that sustainable transformational change by sharing with policymakers where you see the needs, what works to meet them, and where those needs need sort of bigger systemic solutions. So we're looking forward to the rest of the conversation today and learning from all of you as well.
That is wonderful. Thank you both very much. Julie, who I want to acknowledge as Dr. Lowell to give proper credit, and Steph, thank you both so much. I think what struck me as I read this report the first time, and then again, hearing you present it, is just how powerful it is to look back and have presented to us a narrative of where we've been, and to think about how it's felt at different times, how different people have had different experiences of those times, what the bright spots have been, as well as the challenges as we shift from the public health crisis to the economic crisis to the public health lingering crisis, just what that all means. The narrative is, I think, very powerful. So thank you very much for that. I am also looking forward to our panel discussion. So let's dive in. Some of my questions touch on things that you raised already, but I hope they can put a finer point on some of the conclusions you've drawn. So let's just jump in. As our first question here is, we saw with our COVID response and recovery granting at VCF, and we often see this with deep-seated problems. You mentioned it yourselves. There are immediate needs to be met, and then we have longer-term systemic changes that need to happen in order for people and the state to thrive. So given your work on this report, given your work on the issues it highlights, what do you see as some of those key short-term and long-term steps that can be taken? So in other words, what are the kinds of actions that should be taken, and who should be taking them?
Thanks, Kate. I can start us off. One of the frames that we've used to help evaluate both short-term and long-term needs is to focus, is kind of break it down into some areas, to focus on income security, infrastructure building, and addressing systemic inequity. And so I can give you some examples in each of those three areas, and then talk about each of those roles. So in terms of income security, we really need to make sure that wage policies ensure a living minimum wage. And that's something that we can do through policy. And that tax credits can provide additional needed support. So, as people have more children, wages might not necessarily make up for that, but household expenses go up. And so things like the earned income tax credit are a great way to provide additional supports to working families. And that safety net programs like the unemployment insurance program pay enough so that people can meet their basic needs. And then we also saw so much in the pandemic that so many people are doing unpaid labor of caregiving, and that those families need to make sure that they have an adequate amount of income coming in so they can live and take care of their basic needs. In terms of infrastructure, housing and broadband need to be available for people, and we saw that in a big dramatic way over the last 2 years, the importance of having really workable systems in place for both of those two areas. And then something people don't always think of as infrastructure is affordable quality childcare so that people can get to work. And we all saw kind of the direct relationship between unpaid labor in the economy when childcare and school closures impacted parents and caregivers' ability to do their jobs. So, so adding on to that, paid family leave in terms of that income security piece is another really important piece. But we all need to continue to meet our basic needs, whether we have paid jobs or not. And then finally, in terms of equity, we really need to be continuing to partner and invest in communities that need resources and communities of color. This includes startup support for minority business owners, and while maybe like slightly less interesting to some people, to us really interesting is better and disaggregated data collection so that we can understand the gaps and address them, which we saw happen in the last 2 years. So, I think that frame helps us sort of begin to understand how we need to approach these things and do short-term investments, but then make some long-term policy changes so that we can continue to make sure that there's income security, infrastructure, and systemic inequities are improving going forward.
If I could add on to that. Yeah, I think Julie did a great job of sort of listing the policies that we know are necessary, both for the short term and the long term, right? Some of these, the income security and these infrastructures that are both needed now and need to be permanent. But I think there's also a process part to this, right? Like the ultimate goal is that a state that's responsive to the needs of Vermonters over time, even when those needs are changing. I think we all hope that we don't have another pandemic just like this one anytime soon. So what does that look like? We want a robust unemployment system, but we also hope that we don't suddenly have 80,000 Vermonters unemployed all at once, and that we need a system, that can always handle 80,000 Vermonters, for example. But a really critical part of making sure that the process is responsive to the needs is having a really good system for identifying the needs. So, whatever those needs are, how they change. So whether that's through public engagement, and it's also through good evaluation and accountability of state services. And, both. And when we say data, I think we're using that as a pretty broad term to acknowledge the need for both quantitative and qualitative data. And as Julie said, broken out by different, with different angles too.
I really appreciate those comments and stuff. What you said about, Julie gave us a little bit of the what. You talked about the process. Those things need to interact. And one of the things that Julie mentioned is the importance, as it relates to systemic inequity, is the importance of partnering and investing. And partnering gets at how we draw out those kind of qualitative pieces of information. When we build trust, we can hear people's stories. We can understand what policy should look like and what other actions should look like to be truly responsive to real people's real needs. So the process piece is important not to lose. Great, well, thank you. So moving on to our next question, some of the solutions that you proposed address areas that VCF and many others have worked on related to closing the opportunity gap, affordability of housing and childcare, access to food, among them. And we've known a long time about these gaps. As you said in your report, people are generally not surprised to learn that when people have a little more money in their pocket, they're more secure and the economy does better. So the problems and needs aren't new. The increased and current awareness around them might be a newish moment. So with that in mind, my question is a little bit of a strategy question, which is, do you see now as a unique moment of opportunity? And what do you think we need to do as a state, as nonprofits, as individuals to really harness this moment most effectively?
Yeah, I mean, I think this really, I just don't think there's any denying the moment of opportunity that's here. And, it's kind of twofold. One, we have seen this really robust government response and the natural experiment. We saw that it was successful. And we also, now know the processes to go through to get resources and out to people quickly. So, we kind of had this playbook ready to plug and go, right? And so now we have to continue the programs that we know were successful. So we've seen what's possible, and we have resources right now in the state to do this work. And we also have, I think, a renewed understanding or an expanded understanding in the state of what crisis really looks like. And I think from a very personal perspective, I think that just people have experienced crisis firsthand and sort of know how difficult it can be and how appreciative and supportive and necessary these larger community supports are. And so I think to really kind of harness that understanding of the power and the need for these larger social responses is really kind of that double. We have the resources and we have the understanding really provides us with the opportunity to act right now.
The other thing I'd say about this moment is I also want to acknowledge that it's not just sort of the economic crisis piece of this that I think is getting a lot of attention, but I want to acknowledge the opportunity we have in the fight for racial justice. So I know the beginning of the pandemic seems like a really long time ago, but the protests in the wake of the killing of George Floyd and over the last year and a half or so, the response to the wave of anti-Asian violence that we've seen tells us that there really is this sort of growing push to really address systemic racism. And, from a state budget perspective, it's a tiny fraction of what we do with state dollars. Again, throughout the COVID response, Julie talked about some of the effort to break down information by race and to respond when there were racial disparities, but it can't just happen in a pandemic and just for this one purpose, right? There's a lot of areas where we could use better data, human services, other healthcare areas, there's a lot of healthcare disparities that we're not tracking nearly as well as we have been during the pandemic. And the labor market is another one where there are certain pieces that we have broken out by race and others that aren't so good. And then, but there are places where, Vermont has been making an effort over the last few years to to get data by race. Policing, school discipline come to mind. But we need a stronger commitment to address those disparities once we have those data. Again, sort of, there's been this effort at improving some of the school curriculum guidelines, but the implementation is really critical too. I think Julie mentioned, those BIPOC vaccination rates might not have improved if there hadn't been BIPOC Vermonters willing to volunteer at those clinics to do all of the outreach in the communities, mainly on a volunteer basis, right? So again, sort of increasing acknowledgement of the need to address these systemic racial inequities, but sometimes limited follow through about making that actually happen. So I would hope that sort of this collective lens that we're using, that Julie and you, Kate, sort of referred to, could be applied, to racial justice as well.
Mm-hmm. Yeah. And do you think that the collective experience of the pandemic, the increased awareness, and for some experience of racial reckoning, do you think that provides energy? Do you think it changes the way policy gets made or the way that decisions get made once we've collected the data?
I think it can. Again, I think it's quantitative and it's qualitative. This is a case where a few stories should matter. It shouldn't be about sort of the numbers, the sort of gross numbers. But I think I think this is the opportunity, and I think the question is how well we utilize the opportunity.
Thank you. Thank you. So for my last question, I wonder if you can reflect a little on where you think philanthropy can make an impact. How can philanthropists make a big impact given the immediate and systemic needs and this moment that we've been talking about?
Thanks. I can kind of kick this one off. I think we've been thinking a lot about sort of the process of policy change and what are the steps that it usually follows. And again, there may not be a usual, and particularly in the pandemic, there's sort of been a lot of it's been reactive. It's been, attempted to be swift. So it's not that there's always a clear-cut process or that it's always the same process for any given policy change. But I do think that often it happens with one person's story. It starts with one person's story, right? So somebody's experiencing a particular challenge and is trying to bring it to the attention of the public or their local policymaker or whoever. And from there, you get enough of those stories and you start to wonder if it's a pattern. So there can be an effort to collect data. Is it a common issue? How many people are experiencing this? What groups of people are there a particular group experiencing it? So that starts to tell us whether it's a systemic problem and help us sort of craft the best policy solution. So, we've sort of been thinking about that process and then thinking about, so where are the places where philanthropy could plug into that process? I think there's a couple of places where there could be a particular impact. One is the telling of the stories. I mean, you're in a, philanthropy is in a unique position to sort of hear some of these needs, in a variety of ways, right? To hear from people who have a particular need. And then again, start to see a pattern, start to see sort of a critical mass of these situations, and then start to make the case for data collection. I do think it's a really critical role of philanthropy to fund research and at least initial data collection. Ultimately, I think that should be the role of the state, but we often have to, in order to make the case to the state that we need to collect the data, sometimes we need to have some data to sort of start to make that case, right? So I think that sort of pilot energy of philanthropy can be brought to bear and sort of like, well, we have enough to make the case that we need to do a broader collection and broader outreach on this. And I would say, like, during this pandemic, I think there's a couple of good examples where research would be really helpful, and evaluation would be really helpful of what's going on. So one example would be, Julie gave some examples of what Vermonters spent relief money on. We gathered some of that with the help of some UVM students interviewing Vermonters, and there's some sort of consumer surveys and things, but it would be great to have a little bit more concrete information about that. What are the programs that made the biggest difference to people? So, which programs, got the best uptake or, the most interest. Julie mentioned, what are current barriers to work? Are they unique to the pandemic or not? Many of them aren't, but if something like a system for 80,000 people, claiming unemployment at the same time, that might be a unique situation, but what are the long term? And then, I do come back to this, the data disaggregated by race. And there's a lot of areas of racial disparity, other healthcare, economic pieces like wealth, home and land ownership, environmental impacts. All of those would be really helpful in sort of informing and shaping what we do with the ARPA funds now, but also sort of how that shapes the long-term solution, the long-term policies that we want in place.
And I can just add to that a couple other areas where there can be an impactful difference. First is to fund public engagement infrastructure. So what we saw in the summer and fall was that the House Speaker and Pro Tem, they made an effort to go out to the communities to hear how people would like to see the ARPA dollars spent and what the needs were in those communities. And they made a real effort to not just go to the usual spaces, but to get to different communities of color who aren't usually heard from, and the voices of those who had been historically excluded. And so to do more of that, to do more of this public engagement, and to ensure that these findings are publicly available in ways that people can then turn to and see what the needs are in the community and easily access. That's one area of need. Another area that's really impactful is microlending, right? Funding entrepreneurship, incubator spaces, and really making sure that business and job growth can happen in Vermont. We know that business and job growth, most of it comes from Vermonters and businesses that are already here. So how do we make sure that those businesses have the small capital they need to continue their growth and get the investments that they need? And then, on top of that, to consciously develop pathways and those partnerships that we've already talked about as being so important to get to businesses of color and those business owners so that they can access those opportunities as well.
Not sure if we lost Kate here. So we may need to wing the rest of the Q&A, which we're happy to do. I don't know if there's questions coming in for the chat or if we're getting Kate back or what's happening here. We're happy to just start taking questions from the chat if that works for people. Or Dan, you want to rescue us? Go for it.
Sure, I'll jump in. I actually just got bumped off and then I came back on, which is why there was a brief cameo during your presentation. Sorry about that. There is one question in the Q&A that's come. It sort of asked the question from John Burton around walking the line between the costs of public sector programs and intervention and private sector needs to compete in the regional and national and global economy, so Vermonters continue to have meaningful employment. If you guys want to reflect on that question from John.
Sure. No, we appreciate that. I mean, I think that there's a couple of different sort of pieces that we would respond. One, I think a lot of I think the point that Julie made, which is that there is this sort of multiplier effect when there is public investment that happens, right? So we know that that these programs go a long way. We saw this sort of uptick in state revenues and state economic activity as a result of a lot of this investment. But I think part of this is also thinking through what do we mean by competitive in an economy, and what do we mean by a strong economy? I think there's a lot of interest in sort of rethinking sort of some of the basis of what we say is a strong economy, and sort of having economic growth be the main goal of our economy versus an economy that makes sure that everybody's basic needs are met. So what does that look like? I mean, from our perspective, we've actually been doing some work and some thinking around, there's a number of bills in the legislature on sort of economic development or corporate taxes and different workforce development ideas. And I think our basic principle on that is that we think investing in Vermont as a whole is the best way to attract businesses and people. A place that employees want to live is a place where businesses want to locate. And we don't, we're not, we tend not to be big fans of programs that are focusing on, individual businesses or individuals coming to Vermont, but more thinking about sort of those broad public investments, again, that sort of serve everybody, like Julie was talking about with broadband and infrastructure and housing and those pieces. So I think our idea of economic development is a little bit different, but I also think that we want to make sure that we're sort of bringing a critical lens to what we think of as sort of typical economic measures and what that means for the sort of collective good.
Great. Thank you, Steph. Welcome back, Kate.
Thank you. It sounds like I missed a good question, and I apologize for my absence.
No sweat. I'm just going to take there's another question in the chat, if I could reflect that in, and then I think we can open it up, and I'll turn it back to you, Kate, to MC. The question from Connor Daly: if the data has allowed this level of analysis, have there been particular sectors that are more resilient than others, other than non-retail tourism throughout the pandemic? Any reflection on the resilience of particular economic sectors in the course of the pandemic in Vermont?
Julie, I don't know if you've dug into some of that. I mean, there's definitely some national trends in terms of which sectors have not just bounced back, but also sort of might be ahead of where they were pre-pandemic. And you're right that leisure and hospitality is not one of them, is not fully back. Julie, anything you want to add, more detail you have on that?
Well, I think I'll just reiterate one of our other points around sort of data in this area is lacking. Like, we can sort of look at really big industry sectors in Vermont and see that some like larger swaths have been doing fine and didn't nearly experience the losses, but the kind of the aggregation of the sectors is so large that it's not always very meaningful just to talk about. I think it might be, without the data right in front of me, like finance and information is a really broad category. But like Steph said, we know that there were certainly some industries and areas that have certainly thrived during this time.
Yeah, so I think Julie brings up a good point. Like some of those big sectors like healthcare, like, schools, there's a range of what those jobs are, right? There are higher paying advanced degree level jobs in those sectors. And then there's sort of the support staff side of that sector, which tend to be low paid. We know that sort of writ large, we lost a lot of low wage jobs in the pandemic. And so that's a challenge. The other thing that I would say we know that is kind of relevant to the conversation is both in this sort of economic downturn and in the Great Recession, that there was a big difference in terms of education level, right? Like, so who stayed unemployed the longest? Those with college degrees or advanced degrees tended to have lower rates of unemployment, or if they were unemployed, had shorter stints. So, again, this is not an economic crisis, so we don't necessarily expect it to follow the same pattern, but we do, we do recognize that, again, when you slice it by education level or age or race or gender, you get a lot of kind of different answers about who's rebounded and who hasn't.
Okay, thank you. Thank you. I see we have some questions coming in. I'm sorry for what I missed. I'd like to encourage folks to put their questions in the Q&A box down at the bottom there. You'll see that at the bottom of your screen. It's different than the chat. Try to use the Q&A if you wouldn't mind. You know that we also have the opportunity for people to come on screen to ask their questions live, if you will, using their voice or their voice in their video. And I'd like to try that out now. I know we have a question from one of our philanthropic advisors. Elizabeth Marks has a question that she is going to join us and pose to the panelists. Hi, Elizabeth.
Hello, Kate. Great panel. Thank you so much for your insights, Julie and Steph. Many of our fundholders are concerned that the pandemic has negatively impacted Black, Indigenous, and other peoples of color the hardest, amplifying those pre-existing inequalities. You mentioned a couple of strategies to support BIPOC communities, such as supporting micro-lending and business incubators for BIPOC-owned businesses. How else do you suggest that our fundholders and we can best help these communities as part of the recovery?
Thanks for that question, Elizabeth. That's a really important one. And I might just dive into something I said in a little bit more detail and then and give you a little bit more concrete example. So, because I've already sort of mentioned supporting BIPOC businesses and the community partners that are already working in BIPOC communities. And so right now there's a bill in the State House that's promoting racial and social equity and economic opportunity and cultural empowerment. It's a mouthful. And so the goal of it, one of the goals of it is to create these community empowerment centers in different parts of the state to support business cultivation as well as personal and professional development and wealth development. And so community partners are already starting to do this work, right? They already see this need. And so to put philanthropic dollars into these centers while the state works on getting, their response hashed out would be such a great long-term investment to really, begin to build these things. And then the state could carry this work on going forward. I see that as one really specific support area that could use some help. And then in terms of, we keep talking about we need more data, we need more data. We had just such a real lifetime example in that the Department of Public Health very quickly, saw nationally that there were differential impacts of the pandemic on people of color, and they spun up their data collection quickly. So they were adding questions to their questionnaires as they went, and were, doing the research, doing the analysis, and saw we had a problem here in Vermont too. And then they adjusted for it, right? They changed how we would approach it. They changed their vaccination timelines, but they also began partnering more and more with communities of color. So I think those are two areas that provide some strong examples of how this needs to be done in partnership with communities of color. And we also need to kind of be able to be swift and nimble so that we can continue to kind of pivot as things arise. But building those partnerships, I think first and foremost is so important. And learning, we just learned from the past 2 years some of the things that have worked. So take those lessons, take the partnerships that have worked and expand upon them and create permanent partnerships going forward, so that you don't have to create them on the fly when the next crisis hits, but that you're creating long-lasting infrastructure.
Great, thank you. Let's stay on the theme of data. And I may ask you to repeat a little of what you just said with this question, but it is important. Can you talk a little bit more about what kind of data, generally speaking, we need and how it might better be obtained? Is it a matter of changing practices or investing in the data gathering tools and methods? And you may also want to speak to what levels of granularity of data are most lacking.
Yeah, all of the above. I mean, I think Julie probably has a lot of thoughts about this, but I do think labor data is one that's challenging. A lot of these things you can break out with sort of micro data in the census, but it's not sort of readily available. So, labor force participation rates by race, and a lot of the national sources tend not to get to, Vermont sample size tends to be small, and so it doesn't hold up. So we do need more survey data, right? We need to go out and survey, actually ask these questions to people more often. But there's also ways, a lot of the labor market data is gathered by the Bureau of Labor Statistics at the federal level, but the state has input into what questions get asked. And some states ask some questions and some states don't. And so there is this ability to, for the state to start asking for more of these questions. To be addressed by race, some of this by race. So I think it's all of the above. The sort of Vermont specific, by Vermonters sort of survey process, and then also utilizing some of those federal tools that already exist that break things out by state to work. And Julie, you want to add anything in terms of your thoughts?
No, I think you did a good job, Steph, of covering it. I think we need both. I'm not going to just repeat what you said, but then I think just accessibility too, adding on that piece so people can find the data once it's there, and that people can really then access it and dive into it.
Okay, very good. Thank you. Thank you. So shifting gears a little bit, do you have any, the Vermont Community Foundation does some mission investing, some lending for projects. Do you have any thoughts on how VCF could use its mission investment funds to strengthen the state, businesses, and economic growth? You previously mentioned that most of the economic growth in Vermont comes from businesses that are already in Vermont, and maybe also Vermont-based companies. So what are your thoughts on mission investing as leverage and where that should happen?
Right. I think, sort of getting back to kind of our economic development thinking, I think you do see that most job growth comes from businesses already here and not from sort of luring new, businesses to locate here from out of state. Similarly, most businesses that are started here are started by people who already live in the state. And I think a lot of that has to do with, it's not just a decision about what's sort of the most favorable tax laws or what other calculations might go into it. It's also about sort of roots. It's about sort of networks. It's about, a lot of things that go into that decision making about where businesses should be. So I think sort of just generally speaking, we would say, I think the homegrown piece of it is really critical. So I don't know. I'm not sure if that directly answered the question, or if Julie wants to add anything.
I think this one's a little bit out of my wheelhouse, Kate, and I need to think about it more. And just chew on it for a little bit before I jump in with more.
Thank you. Yes, they're not necessarily easy answers to this questions, but I appreciate what we're hearing from our participants and how they're making us think about where to create opportunity and what tools can be used for that in each area.
Mhm.
So we have time for one more question. And the question I'm going to ask you is, this is from one of our supporting organizations, Meg Smith, at the Vermont Women's Fund. Many funders are concerned about working mothers, and that worry is really validated by the report. How does this report suggest we might help working mothers the most?
Julie gave a pretty good list of policies, I think, that would help.
I may have missed this. I apologize.
No, not at all. No, I think, paid family leave, I think a couple of, but I also think, we've been thinking about this sort of at an organizational level too, at public assets, and sort of thinking about what is it, I think there's a real reset of sort of work expectations happening as a result of the pandemic, and also an acknowledgement of the ways in which caregiving, again, speaking of sort of the increased visibility of some of the challenges of the pandemic, this is one of them that has really been really had a lot of increased visibility in terms of recognizing just where caregiving and professional responsibilities collide and how difficult it is to juggle all those things, even when it's not in a pandemic. So I think there's a lot of recognition of the need to balance better. One other thing, I think Julie may have mentioned this child tax credit that's in the legislature right now. I mean, I think what we see and have seen in past reports is that we are failing single mothers and children pretty dramatically, right? Like that the share of children in poverty, a large share of them are living with single mothers, and the juggling of the work and the caregiver and the caregiving and the responsibilities and costs and the financial impact of kids is really significant, and we're not doing enough to kind of invest in families. So yeah, wage policy, tax policy, all of these things, where philanthropy comes in. I think you all have mentioned the interest in childcare and a robust childcare system. Yeah, and worker-friendly policies across the board, consistent scheduling, flexible schedules, but I also think flexible schedules can sort of be a double-edged sword. You also want responsibilities that can fit the size of the time that you have. And so it's not just, can you work at a different time? It's also, can you have a job that makes it work with your family? So, I don't know, anything Julie wants to add there.
Very good. I should probably let that be our final comment. This is a rich conversation that could go on. Thank you, everybody, for the great questions and the very thoughtful answers. We've reached the end of our conversation. Thank you for being with us. Thank you all for your participation, our panelists, our tech folks, and especially our participants. As we close, I'd like to ask you to please take a moment to fill out the survey that will appear when you sign off of this webinar. It helps us plan future events. If you'd like to learn more about the Public Assets Institute, please visit their website. It's publicassets.org. You can sign up for the mailing list if you choose. And then keep an eye on your inbox, please, for an email that will include a one-page summary of some takeaways from today's event. Lastly, as we've mentioned, this is a series of Insight Hub events, so we hope you'll join us again. The Insight Hub has many more events planned, and you can keep an eye out for invitations. You can sign up at vermontcf.org/insighthub to stay in touch. With that, I want to thank you all again very much for attending and wish you all a good afternoon. Thank you.
Thank you.
Thanks. Bye.